In modern society, there's a seemingly never-ending struggle between the old and the new, tradition and modernity, and nature and technology. This struggle is present in all avenues of life, especially education, entertainment, and even the menial tasks that make up our day. Whether it's a diagnosed medical condition or a teenager's regular morning skincare routine, there's always the lingering question of whether it's wiser to rely on the traditional remedies used by older generations of various cultures or the pharmaceutical treatments more widely approved by Western culture. Good afternoon. My name is Anya Goyal, and I'm a student at Jordan High School, presenting from Katy, Texas. And I had the privilege to be mentored by Benjamin from the University of Michigan. I chose to research the efficacy of natural remedies because I've personally struggled with skin issues, especially acne. Like many people, I was curious about what really works better, natural remedies or pharmaceutical treatments. That personal curiosity became the foundation for this whole project. But of course, this question isn't just mine. It's part of a much larger debate. For example, history shows how deep this debate runs. Medicinal plants have been used since the Middle Ages, yet modern medicine dominates in clinical practice. For example, a study in Ethiopia found that 35.5% of dermatology prescriptions were for topical corticosteroids, drugs valued for their quick anti-inflammatory effects, but not without risks when overused. At the same time, interest in alternatives is rapidly growing. In the US, spending on the complementary and alternative therapies reached $13.7 billion in 1990 and nearly doubled by 1997, with herbal remedies becoming the fastest growing segment. This led me to my central research question. To what extent can natural treatments assist in successfully treating dermatological conditions, and what are their potential consequences, and how are these treatments portrayed on social media? All of this shows that natural remedies are not just old traditions. They're still very present and increasingly popular today. But despite their history and rising demand, they remain under-researched and underutilized in Western medicine. My study had three goals. First, it was to evaluate the effectiveness of natural remedies in treating skin conditions such as acne, eczema, wounds, and signs of aging. Second, it was to examine their potential side effects. And third, to analyze how these treatments are portrayed on social media compared to pharmaceuticals. To address these goals, I designed my research into two parts. First, I conducted a literature review using databases like PubMed and Google Scholar, focusing on studies published between 2000 and 2025. I specifically looked for high-quality clinical trials, meta-analysis, and experimental studies that examined the therapeutic effects of natural remedies on skin conditions. Second, I designed a survey and distributed it to 15 high school students using Google Forms. Since this age group is highly active on social media platforms like TikTok and Instagram, they provided valuable insight into how natural remedies are portrayed online. The survey explored three main areas: participants' general exposure to skincare content, their perceptions of natural versus prescribed treatments, and their personal use of these remedies. Finally, because many of the participants were under 18, I included multiple ethical safeguards, such as parental consent, confidentiality, and anonymity of all responses. Now that I've outlined my methods, let's move into the results. I organized my findings into four main dermatological conditions, such as acne, eczema, wounds, and aging. So let's start with acne, one of the most common skin conditions. Acne happens when pores get clogged with too much oil called sebum and dead skin cells. The first remedy found effective was tea tree oil at a 3% concentration, which reduced acne lesions more effectively than erythromycin, a common medicine found to be given by prescriptions. Additionally, lavender oil showed antimicrobial and anti-inflammatory properties, helping reduce redness and regulate sebum production. Overall, plant-based bioactive compounds disrupt bacterial growth and oxidative stress, making them a promising alternative to traditional antibiotics. Next is eczema, also called atopic dermatitis. It's a chronic skin condition that causes dryness, itching, and even inflammation. It was found that aloe vera improved skin hydration and elasticity by 20 to 30%. Furthermore, curcumin from turmeric reduced inflammation by blocking the NF-κB signaling pathway, ultimately restoring the skin barrier and alleviating common symptoms. Finally, the evening primrose oil contains a linoleic acid, which is an omega-6 fatty acid that provided a 30 to 45% improvement in eczema symptoms like itching, dryness, and even scaling. These results suggest that natural remedies can help manage eczema, even though clinical adoption is still limited. Moving on to wounds. A wound is simply when the skin tissue is broken or damaged, such as from cuts, burns, or even ulcers. Natural remedies have been surprisingly effective here. Like, for example, honey was found to have healed burns 5 to 8 days faster than standard hospital dressing, proving not only its effectiveness in accelerating wound recovery, but also its potential as a natural, low-cost alternative to conventional treatments. Walnut extracts promote healing by stimulating cell growth and preventing infections through increased keratinocyte and fibroblast growth. Finally, a proven effective remedy for wounds are willow bark fibers. Willow bark fibers reduce bacterial biofilm formation from Staphylococcus aureus, a common wound-infecting bacterium, suggesting faster wound healing. Lastly, let's look at skin aging. So aging is a natural process where skin develops wrinkles, loses elasticity, and shows damage from sun exposure over time. Some natural compounds that showed promise were polyphenols, which is from the coffee plant, which reduces wrinkles and pigmentations. Another one was flavonoids and antioxidants, which are found in multiple fruits, berries, and teas, which help protect the skin from UV damage. And finally, astaxanthin, a marine carotenoid, which improves elasticity and reduces wrinkle depth. These results suggest that natural remedies may slow visible signs of aging when used consistently. Of course, natural doesn't always mean safe. The most common issue is allergic reactions. Allergic contact dermatitis has been reported from remedies like aloe, arnica, chamomile, and even tea tree oil. Another concern is drug interactions. For example, a plant called St. John's wort has been shown to reduce the effectiveness of oral contraceptives, cyclosporin, and even some anti-cancer agents. Another plant, which is called ginkgo biloba, has been linked to bleeding complications when combined with anticoagulants such as warfarin or even aspirin. Finally, garlic supplements can decrease HIV protease inhibitors and also raise bleeding risk when taken with other medications for thinning blood. These examples emphasize the need for patients to always disclose herbal use to their healthcare providers, as even common supplements such as garlic supplements can alter clinical outcomes in significant ways. Now, let's look at the role of social media in shaping how participants from my survey viewed natural versus pharmaceutical treatments. In figure 1, you can see how often participants reported seeing posts about different treatments. About 87% said that they saw natural treatments on their feed, compared to 73% for pharmaceutical treatments. This tells us that natural remedies are more visible on social media platforms like TikTok, Instagram, etc. In figure 2, I asked participants which treatment seemed safer based on how it's portrayed online. The majority leaned towards natural remedies, as many participants chose higher scores at like a 4 and a 5 on the scale, meaning they saw natural remedies as gentler and safer options compared to pharmaceuticals. This shows that social media tends to frame natural remedies in a very positive light. Finally, figure 3 shows how social media actually influence behavior, with 73.3% of participants admitting trying a natural remedy after seeing it promoted online. That means what they see on social media doesn't just shape opinion, it directly shapes behavior. Altogether, these figures suggest that social media plays a major role in shaping perceptions and even actions around skincare, often favoring natural remedies over pharmaceutical ones, regardless of any scientific evidence and backing. To bring everything together, the central objective of my study was to examine the role of natural treatments in dermatology. My findings showed that natural remedies like honey, aloe vera, curcumin, and even essential oils can be effective. However, they are not without their own risks, such as allergic reactions, drug interactions, and even inconsistent formulations. At the same time, social media often portrays natural remedies as safer and more desirable than pharmaceuticals, even though the evidence is very limited. Like any research, there are limitations. First, there are still relatively few high-quality clinical trials and natural remedies, which makes it difficult to draw universal conclusions. Second, the survey was only limited to 15 high school students, which is a small and non-representative sample. Third, this review focused on short to medium term studies, as long-term safety and effectiveness of many natural remedies remain under research. Despite these limitations, one thing is clear. Natural and pharmaceutical treatments don't need to be seen as opposites. Both have value and both have risks. Eventually, the most effective dermatological care of the future will be the one that blends tradition with innovation. Treatments that are not only effective, but also safe, accessible, and balanced. These are my references, and thank you for listening.
Great job. Great job. Thank you so much. One quick question, kind of right off the bat. What drew you to this topic? Like, is this kind of a trend that you were already seeing on social media and wanted to explore more, or one day you spilled honey on your hand and the burn was gone?
That's a good question. What drew me to this topic was, like, as I said in the beginning, it was because like, personally suffered with multiple, like, skin conditions like eczema and acne. And I used to, like, go crazy, like, trying to figure out, what fixes, like, pharmaceuticals. And then sometimes I even tried, like, natural face masks that my parents knew of. Eventually, like, it did, like, go off as my hormones, like, came back in check and everything. But like, yeah, that was like my main, like, my curiosity was the main foundation for like this whole project. And like it was really interesting, like, finding, like, there's so many, like, remedies that, like, like, not remedies but like natural components that people know of, but they wouldn't know that that would be an effective remedy to a certain skin condition.
Interesting, interesting. You have a question in the chat that I'm going to kind of like also adapt. So the question in the chat mentions that in your chart, right, it shows most people on social media think that natural remedies are safer. And then the question is kind of like, how much of that is because of like the population that you sampled? And then my add-on question to that too is, if you had a larger population to sample, or like let's say you like built on this and did more surveys, would you want to get specific with what type of social media platform you were like looking at too? I wonder if it would just be different, like TikTok versus Instagram versus whaver
Yeah, that's a
quote.
good question. So for the first question that was in chat, yeah, I definitely, like, agree that it's still a limitations because it was only 15 high school students that I personally knew. But I feel like if I did use a bigger general representative sample, I would be more specific with my question as to what content they're seeing specifically on a specific social media app, and then maybe have like statistical significance, like, in differences of what they're seeing and like their perception of like the content that they're looking at and their reaction, like if they're using it themselves or like, yeah.
Yeah, yeah, and yeah, like what I guess behavior, like actions are like coming out as a result too.
Mhm.
That's very cool. What was like the most surprising thing that you learned through the process?
I think the most surprising thing I've learned from this whole research process was probably the drug interaction aspect,
Mm,
because I didn't know that, like, just like a simple plant would make such a huge difference in an individual's life if they're already taking a specific, like, prescribed treatment. Like garlic supplements, there's typically known to be used for gum health, right? And just like researching and like finding out that like it can also like decrease like HIV post-use inhibitors, which is like a common enzyme that's like part of the virus's life cycle. Like, it's very interesting.
I would never have guessed that. Yeah, that's
Yeah.
wild.
Hmm.
Oh my gosh, fascinating. Okay, wonderful. Well, thank you so much for your presentation, all of your work.